HIV in people who use drugs is both preventable and a treatable disease, but only by using evidence-based interventions based on science and knowledge, but not on opinion and prejudice.
Thank you.
So if that is the case, why do people who use drugs account for 1/3 of all new HIV infections worldwide outside sub-Saharan Africa? Why globally 1 in 5 people who inject drugs are infected with HIV? Why are 60% of the HIV infection in Eastern Europe occurring through intravenous drug users? Annually, since the 1990s, new HIV infections have been reducing everywhere except 7 countries, which have increased by 25%, and most of that increase is through intravenous drug use. I could go on with lots of statistics. There are a lot more. And I ask you why that is the case, and I'm going to answer my own question. Because of stigma, because of criminalization of people who have a health issue, because of the war on drugs, which in fact is a war on people, and has failed dismally to reduce drug use. Governments, people, and sadly some of my own profession, doctors, believe that people who use drugs are either bad or in fact mad and can't make decisions for themselves. They do not look or accept evidence. They ignore the public health approach and falsely believe that if you use criminalization that you will reduce drug use. Well, everybody here, I'm sure, knows that this is absolutely false, that if people are treated with humanity rather than criminalization, that actually drug use doesn't surprisingly go up, and in some countries it has in fact gone down. The war on drugs is appalling. With all this in mind, we set up IDHDP, which stands for, and if you haven't got your badge, get one. IDHDP stands for International Doctors for Healthy Drug Policies, and we want to be the voice of doctors in drug policy reform movement. We know that the public health, the harm reduction approach works, and healthy drug policies can promote health in people who use drugs. We want to strengthen the gap between evidence-based clinical medicine, i.e. using what we know works, and policy which aims to, and which should also be evidence-based. Policy needs to be evidence-based as well as practice. We know that drug use is often a complex, multifactorial health issue, and first and foremost needs to be addressed by treating people who use drugs problematically with respect and with evidence-based treatment. We need to, as doctors, try and influence drug policies, well, influence them, because we know that improves health. But not only must we go that way to drug policies, we should also influence and educate our own colleagues in all areas of medicine, particularly in drugs, in HIV, in pain, and many other areas, to use evidence-based interventions. If we do that and work for policy change, things will hopefully improve. And I don't know if anybody else was, but I was really disappointed in Hillary Clinton, who talked lots about lots of things and only once mentioned people who inject drugs, and that was in the context of Africa. It was not in the context of US, where HIV in people who use drugs is increasing. So please, all the doctors in the room, join up to IDHDP, and anyone else who isn't a doctor, please sign up to the forums, and let's discuss this much more forcibly. Thank you.
Yeah.